The human spine is the central axis upon which our whole body is arranged. It is to this axial skeleton that the appendicular skeleton with the arms and the feet is attached. Through this spinal column runs the spinal cord that is at the top attached to the brain, thus governing the function of all systems in our body. The spinal column, consisting of these vertebrae, the intervertebral joints and the paraspinal musculature, is very essential for all functioning of the body. Yoga gives tremendous importance to the human spine, calling it the Brahma Danda, meaning God's own walking stick, as if our spine is the walking stick of the divine. Keeping it healthy is very important in the yogic view. The various asanas that help stretch the spine, where you stretch up in the Tadasana, or you turn in the Trikonasana, you bend forward in the Pavanmuktasana. All the asanas are based upon either the flexion, that is the bending forward, the extension, the bending back, or the twisting of the spine. Through the regular practice of yoga from childhood, we can prevent the numerous problems such as back pain, lumbago, the sciatica, the neck pain that is affecting so many people today. With the increased automation and use of computers, more and more people are coming down with low back, mid back and neck pain. Yoga strengthens the entire back, strengthens the spinal column through the right useness of the spinal column. This presentation takes a look at asanas that help us to stretch the spine. The entire spinal column is given a healthy tug, giving self-traction to your spine, helping pull the vertebrae apart, giving that traction that normally would only be given in hospitals, where you put a weight on one side of the head and on one side of the feet. The asanas provide that isometric stretch that is so essential to the muscles of the back, stretching the muscles yet giving them relaxation. Practices like the Pavanmuktasana help relieve back pain and neck pain in a very effective manner. A gem of a practice is the Brahma mudra, where we turn to the right, to the left, up and down. This turning is done along with the breath and along with the sound, nada, providing healthy vibration to the tissues of the neck. We must never forget that the neck and the back are one and the same. A person who has a neck problem today will have a back problem tomorrow. Person who has a back problem today will have a neck problem tomorrow. It is essential that yoga therapy deals with the back and the neck as one unit, strengthening the back muscles, strengthening the joints, giving us increased turn ability, the ability to turn that is so lacking as we grow older. This presentation takes a look at the excellent musculoskeletal relaxing practices such as the Kayak Kriya, where the feet, the arms and the head are relaxed in a step-by-step manner. The Drida Kriya, which is an excellent relaxer for the spine, is also introduced. Practices such as the asanas to strengthen and relax the paraspinal muscles, the practices to help improve the flexibility of the spine, the pranayamas to reduce stress that creates a tension in the muscles. All of these are introduced in this presentation. The restoration of balance of the three doshas, Vata, Pitta and Kapha. Vata is the one which is the air. This air element which in Ayurvedic and yogic terminology is called Vata, it affects the joints. So the joints of the neck, the joints of the entire spinal column, these are brought into their normalcy by the practice of pranayamas such as the Shitali and the Kavi pranayama. Of course, it may not be possible to do all the practices in this presentation at one time. I recommend that you consult a qualified yoga therapist. Make up a schedule according to your age, gender and physical condition, and follow that schedule in a regular manner. With the regular and dedicated practice of such a schedule, I am sure that you will soon move from that state of ill health to that wonderful state, the state of optimum health. Namaskar.
Tadasana. Take up a comfortable and stable Samastiti Asana. Breathe in and lift both arms up over your head until they are parallel to each other. Let the palms of both hands face inward and then go up onto your toes and stretch up as high as possible. Hold the breath and feel the healthy stretch along your whole body from toes to fingertips. Breathe out and relax your arms back to your sides while coming back to the flat foot posture. Repeat the practice 2 more times at each session for maximum benefit. The term Tala refers to a palmyra tree, and you should try to stretch yourself as tall as that tree while performing this practice. With practice, the posture can be held for a longer time and normal breathing done while holding the posture for 30 to 45 seconds. When ready, slowly come back to the Samastiti Asana and relax with a few rounds of deep breathing. Hasta Kriya. Stand in Samastiti Asana with your arms by your sides. Slowly breathe in and lift your right arm over your head. Try to extend the arm over your head towards the left as far as possible without bending it. This gives a good stretch to the entire right side of the body. Slowly start to breathe out and lower your arms back to the side. Perform the practice on the opposite side by lifting your left arm over your head while breathing in. Extend it as far towards the right as possible without bending it. Feel the excellent stretch on the entire left side of your body. Lower your arm back to your side while breathing out. Repeat the practice a few more times for maximum benefit. Hasta Kriya helps to stretch the musculature of the arms, shoulders, and paraspinal area in a way not done in our day-to-day lives. This helps trigger the relaxation response in these tissues that are normally tense due to disuse, misuse, and abuse. A sense of profound relaxation is obtained after the sincere and regular practice of this activity that is also known as the Ardhakati Chakrasana, as it provides a half stretch to the hip region. Trikonasana. Stand in Samastiti Asana. Place your feet 2 to 3 feet apart and stretch the arms to the sides so that they are pulling the chest in opposite directions. Turn to the right side and slowly bring the right hand down to the right foot and place the palm of the right hand on the ground in front of the right foot. Look up at the middle finger of the left hand. Let the entire torso get a good twist and stretch. Hold the position for 30 seconds while performing deep breathing. Release and come back up to the open arm position. And then do the opposite side by placing your left hand down in front of the left foot. Hold the position for 30 seconds while performing deep breathing. When ready, slowly come back up to the Samastiti Asana and relax with a few rounds of deep breathing. Parsvakonasana. Stand in Samastiti Asana. Place your feet 3 feet apart and stretch your arms to the sides. Turn to the right and bend your right knee. Bring your right hand down to the right foot and place the palm on the ground in front of the foot. Look up at the middle finger of the left hand. Let the entire torso get a good twist and stretch. Stretch your left arm over the head and continue to look at the middle finger of the left hand. Hold the position for 10 to 30 seconds while performing deep breathing. Release and come back up to the wide arm position in the same manner as you have gone into the posture. Repeat on the opposite side by taking your left hand down in front of the left foot and then stretching your right arm over your head. Hold the posture for 10 to 30 seconds with relaxed breathing. Come back to the Samastiti Asana step by step and then relax with a few rounds of deep breathing. Hamsa mudra. Hamsa mudra, the swan gesture, may be considered the reverse of Namaskar mudra, that is done palms together in front of the chest. Take your hands behind your back and place them together with your palms touching. This resembles the wings of a swan or a Hamsa. Hamsa mudra opens the chest and is a wonderful exercise for the joints of the shoulders, elbows, and wrists. When ready, bring your hands back to Namaskar mudra, the gesture of greeting, and then lower them back to your sides. Garudasana. Stand in a steady and comfortable Samastiti Asana. Perform the Garudasana by balancing on your left leg while bringing your right leg across and around the left so that both legs are intertwined. Now perform the Garuda Hasta mudra by crossing your right hand over the left so as to intertwine both hands and twist them up to your face level. Garudasana provides a slow and sustained stretch to the muscles of the arms and legs that produces an excellent relaxation response in these tissues. When ready, slowly release the foot and hand positions and come back to the Samastiti Asana for some deep breathing and relaxation. Repeat the practice by performing it on the opposite side in order to also attain the healthy musculoskeletal benefits on that side of your body too. Garudasana stretches the spinal column and helps alleviate musculoskeletal problems of the back and extremities. When ready, slowly release the foot and hand positions and come back to the Samastiti Asana for some deep breathing and relaxation. Vajrasana. To perform this asana, sit on the ground with both your legs stretched out in front. Slowly bend both your knees and come into a kneeling posture. Gently sit down on your heels so as to put the weight of your entire body on your heels and ankles. Try to keep the ankles and heels of both feet as close together as possible. Sit straight with your spine erect and both your palms on the respective thighs. Perform a few rounds of deep and controlled breathing while in this posture. Vajrasana, the Thunderbolt posture, is an invigorating posture that helps us to generate and conserve the vital pranic energies for health and well-being. This posture may be done after any meal as it helps to improve the digestive process greatly. When ready, slowly come back up onto the knees and then relax by sitting on the ground with your feet stretched out in front. Shake your feet a few times and then thump your thighs to relieve the legs of any accumulated tension. Purna Shashasana. From Vajrasana, bring your hands forward and place your palms on the ground directly in front of your knees. Your wrists and knees should be as close as possible. Keep your arms straight and lift your head and look up as far back as possible. Perform 3 to 6 rounds of deep and controlled breathing into the mid-chest while holding this final position. After performing the required rounds of breathing, let your head relax onto your chest for a few seconds before repeating the practice 2 more times at each sitting. After performing 3 rounds of practice, release the position and come back up to the Vajrasana. Place your palms back on your thighs and perform a few rounds of head rolling to help dissipate any tension in the neck and shoulder region. Ustrasana. Ustrasana, the camel posture, is done from the heel-sitting Vajrasana. On an incoming breath, raise your body off your heels and come up onto your knees. Keep your eyes open and slowly back bend. Take your hands back and catch hold of your heels with your hands. Push your lower back forward to help attain a good posture. Once you have reached this final position, do half a dozen forceful bhastrikas or bellows-like breaths with total awareness on the movements of your diaphragm. Breathe in through your nose and blast out through your mouth. This practice is known as the Nasarka Mukha Bhastrika. Slowly sit down while breathing out and come back to the Vajrasana. Repeat the practice 2 more times. It is important that you keep your eyes open in order to avoid fainting or falling over especially in the beginning, as your brain has to get used to the new patterns of circulation that occur in this posture. The camel posture stretches the spinal column and produces a healthy spine and resilient back muscles. It helps strengthen the diaphragm and the solar plexus by building up physical power, endurance, and resistance to diseases. It also massages and stimulates abdominal organs through the extensive movements of the diaphragm. Slowly come back to the Vajrasana and relax with some deep abdominal breathing for a few minutes. Gomukhasana. Sit in the Vajrasana with your spine as erect as possible. Cross your knees with the right leg over the left and then bring your feet back so that you are sitting between the heels of your crossed feet. Perform the Gomukha mudra by taking your right hand over your right shoulder and catching it from behind by your left hand. Fix your gaze on the tip of your upright elbow. This creates a healthy circulation in the upper part of the body and massages the tissues of the neck, shoulder, and upper areas of the spinal column. Slowly release the hand and leg positions and come back to Vajrasana for a short period of relaxation with deep breathing. Perform the practice on the opposite side to create a balanced effect on both halves of your body. It also releases unhealthy tension that tends to accumulate in the upper spinal and neck regions from sedentary desk jobs and physical inactivity. Slowly release the hand and leg positions and come back to Vajrasana for a short period of relaxation with deep breathing. Mandukasana. Sit in Vajrasana and then open your knees to create a wide-kneed posture. Bring the great toes of both feet as close as possible behind your back. This is the Mandukasana. To perform the Manduka mudra, take both your arms over your shoulders and place the palms onto the sides of the spinal column. Bring your elbows as close together as possible. Keep your head balanced, straight, and look forward. This opens the whole shoulder and upper back region and gives this overused region a good stretch. It helps improve upper chest breathing and creates a healthy chest expansion. It realigns the pelvis and produces good reproductive and excretory health. When ready, slowly release your hands and feet and come back to the sitting position for some deep breathing and relaxation. Vakrasana. Sit erect with your legs stretched out in the Uttanasana. Bend your right knee and place the right foot by the side of the left knee. Turn to your right and place your right hand on the ground behind you to support your erect position. Bring your left arm round the outer side of the right knee and catch hold of the right big toe. Turn your head and look back over your right shoulder. The erect knee acts as a fulcrum for getting maximum twist of the spine. Keep your torso as straight as possible. Hold the posture for 10 to 30 seconds with soft breathing. Release the posture and come back to the Uttanasana. Repeat the practice on the opposite side. This posture gives an excellent massage to the abdominal organs and is very useful for those suffering from diabetes as well as digestive disorders. It is also useful for back and neck problems. Dandasana. Sit erect with your legs stretched out in front with your palms pressing on the ground by your sides. Stretch your arms over your head so that the inner sides of your arms touch your ears. Intertwine your fingers and turn your palms upwards to get a good stretch in your upper back and neck region. The Dandasana helps relieve tension in the upper back and neck region, and the arm stretch part may be done even while sitting in a chair at your office or home. When ready, relax your arms back to the sides and lie down in Shavasana for some relaxation. Chatuspadasana. Sit in Vajrasana. Place both your palms on the ground in front of you and lift up until you are in a four-footed pose. Your weight should be equally balanced on your two hands and knees. Keep your body parallel to the ground and perform deep and rhythmic breathing. When we perform Chatuspadasana, our body organs are free from the negative effects of gravity that are otherwise present during the upright stance of our daily life. After performing the posture for a comfortable period of time, slowly relax back to the Vajrasana and enjoy the feeling of relief that is produced by this simple yet effective posture. Chatuspada Take up a comfortable Chatuspadasana and start moving around your area in one direction while using all the joints of your legs and arms. This is very useful for those suffering from neck and back troubles as it takes the load of the body weight off the spine. Chatuspada Kriya is good for patients of mild to moderate arthritis but must be done carefully and on a soft surface to avoid trauma to the knees. The upright stance of the human being is one of the main causes of many health-related problems due to the negative effects of gravity on our internal organs, back and blood vessels. Repeat the practice by moving around in the opposite direction. Chatuspada Kriya neutralizes the negative effects of gravity on the human body and helps correct lumbago, organ prolapse, piles, and varicose veins that are primarily caused as a result of our standing upright on our feet. Continue moving around in the four-footed posture and then when ready, slowly relax back to the Vajrasana. Vyagraha Pranayama. The tiger breath helps relieve numerous musculoskeletal problems that are the bane of modern life. Take up the Chatuspadasana with your weight evenly distributed between your hands and knees. Start breathing in and out for an equal count of 6. While breathing in, slowly lift your head and arch your back downwards. Then breathe out slowly and lower your head while arching your back upwards. Vyagraha pranayama helps utilize all sections of our lungs in a balanced and controlled manner, thus energizing the whole body with healing pranic energy. This is also very good for those suffering from musculoskeletal disorders of the joints. It is a simple and yet effective practice to prevent and manage the numerous gynecological disorders of women and is a boon for the pregnant woman. It is an important component of rejuvenation and rehabilitation. When ready, slowly relax back to the Vajrasana for a period of quiet contemplation. Meru Asana. Sit in Vajrasana. Come forward and perform the four-footed Chatuspadasana. Straighten your knees and arms and raise your buttocks up until the soles of both your feet are flat on the ground. Keep your hands and feet in parallel so that the right hand and right leg as well as the left hand and leg are in a single line. Perform a few rounds of regular breathing while holding the pose and contemplate the steadiness and might of a huge mountain. When ready, release the pose and come back to the Chatuspadasana and then the Vajrasana for some relaxation. Chakri Kriya. This excellent breath and body movement coordination activity, named after the cricket, is performed from the Chatuspadasana. Take in a long, slow and deep breath and stretch your right leg straight back along the ground. Lift it as high as possible and look up to perform the Sharabhasana. On the out breath, bring your leg down and lower your head until your forehead touches your right knee. Perform this complete cycle of the cricket movement 3 times on the right side before relaxing back to the Chatuspadasana. To obtain equal benefits for both sides, perform the practice on your left side. Excellent spinal health is developed by the regular practice of this breath movement cycle that can even be quite meditative and contemplative when done in a slow and steady manner. Relax into the Shashangasana with your arms stretched out in front and then finally come back to the Vajrasana. Brahma Mudra. Brahma Mudra is a gesture of the head and neck and is an excellent practice for one and all. Take up any comfortable sitting position such as Vajrasana with your spine as erect as possible. Breathe in and turn your head towards the right. 1, 2, 3, 4, 5, 6. Breathe out while bringing your head back to the central position and make the guttural sound Ah. Slowly turn your head to the left while breathing in. 1, 2, 3, 4, 5, 6. Breathe out and bring your head back to the central position, making the labial sound U. Slowly lift your chin up as if attempting to look at the sky and breathe in. Breathe out and make the palatal sound E while bringing your head back to the central position. Finally, lower your head, bringing chin to chest while breathing in. Breathe out and make the labial sound while bringing the head back to the central position. To repeat the practice a second time, breathe in and turn your head to the right. Release with the sound A. Breathe in and turn your head to the left. Release with the sound Oo. Breathe in and lift your head up. Release with the sound E. Breathe in and lower your head. Release with the sound Perform a minimum of 3 to 9 rounds of this practice at each sitting. Brahma Mudra is an excellent practice to prevent as well as relieve disorders of the cervical spine that are so common in this modern day and age. It is important to concentrate on the area of the neck to be relieved, repaired, or rejuvenated while sounding the Bija mantras. When you are finished, sit in Vajrasana and concentrate on this valuable practice that combines the use of physical movement synchronized with deep breathing and the usage of nada or vibrational sounds. Kayak Kriya. Lie down in the Shavasana and stretch your arms over your head. Breathe in and roll onto your left side, keeping your body as straight and stiff as possible. Hold in your breath while balancing on your side for a few seconds. You should be aware of the stretch from the tips of your fingers to your toes as you stretch them in the opposite directions. Release your breath with a mighty whoosh and flop onto your back, offering no physical resistance to falling back into the supine position. On the next incoming breath, slowly roll on to your right side and hold the pose while holding your breath for a few seconds. Make sure that you are stretching from the tips of your toes to the tips of your fingers. When ready, flop onto your back with a whoosh and enjoy the relaxation. Repeat the Kayak Kriya at least half a dozen times at each session to work out the stiffness and aches from your entire musculoskeletal system. A deep sense of relaxation is obtained by the regular practice of the Kayak Kriya. When ready, relax your arms back to the sides and lie down in Shavasana for some relaxation. Pavanmuktasana. Lie down in a comfortable Shavasana and start to breathe in and out for an equal count of 6 or 8. To perform the single leg Ekapada Pavanmuktasana, bend and lift your right knee while breathing in and simultaneously also lift your head off the ground. Catch hold of your knee and try to touch your knee to your forehead. Hold the position for a few seconds and then while breathing out, slowly release the position and lower your head while at the same time bringing your foot back to the ground. Perform the practice on the opposite side by bringing the left knee to the forehead. Hold the position for a few seconds and then slowly release the position and lower your head while at the same time bringing your foot back to the ground. Repeat this at least 2 more times to complete a set of 3 rounds of the practice. This practice helps relieve the stress and tension that tends to accumulate in the abdominal region. It is also useful to prevent and control the various joint disorders that afflict the limbs and the abdominal organs. Relax in Shavasana for a few minutes with deep and rhythmic breathing while concentrating on your abdominal area that will help to relax you further. To perform the double leg Dvipada Pavanmuktasana, bend and lift both your knees while breathing in. Bring them as close to your forehead as possible while simultaneously raising your head to meet the knees. Hold a few seconds and then while breathing out, lower your head and simultaneously bring your feet back to the ground. Repeat this 2 more times to complete a set of 3 rounds at each session. The Pavanmuktasanas help to prevent and relieve joint pains, gas troubles, and abdominal problems such as indigestion and constipation. They are also useful for persons suffering from diabetes mellitus as well as liver disorders. When ready, relax in Shavasana for a few minutes with deep and rhythmic breathing while concentrating on your abdominal area. Purasana. In Uttanasana, place the hands behind the back with the palms on the ground. On an in-breath, lift the body so that the entire body is arched from the feet that are flat on the ground to the head that is loosely dangling between the shoulders. The fingers must point towards the back. Release the pose on the out-breath and relax in Uttanasana. This is a good complementary pose to both Paschimottanasana and Halasana. Bhujangasana. Lie down in the face-prone Unmukhasana with your hands by your sides. Bend both your elbows and place the palms on the ground by the side of your chest. Slowly lift your head and then raise your chest until your arms are as straight as possible. Feel the awareness of the bending at the lumbar region. After a few seconds, relax and bring your chest and head down, touching the ground with your chin. Release your hands and then relax in the Unmukhasana. Repeat the practice at least 2 more times for maximum benefit to the muscles of the lower back and posterior region. This practice helps tone up the muscles of the entire posterior region and redistribute any fat from the hip and lower back region. Dhanurasana. From Unmukhasana, fold both your knees and catch hold of the feet with the respective hands. Raise your head and chest and also the thighs by tugging on the hands and legs so that your entire spine is arched backwards like a bow. Look up and feel the stretch in the entire back. Hold for a few seconds and then relax back in the face-prone posture. Dhanurasana massages all the abdominal organs and restores proper function to the digestive system. Repeat the Dhanurasana at least 2 more times for the maximum benefit. Do not do this posture if you suffer from any diseases of the liver or kidneys, as the intense pressure may be too much for the weak organs. Vakrasana. Take up a comfortable face-prone Unmukhasana with your arms by the side of your body. Spread your legs 1 foot apart so that your hips and lower limbs feel relaxed. Lift your head and bring your left hand in front and place down in front of your face. Place your right hand over the left and then relax your chin on the back of your right hand. Enjoy a period of quiet rest and relaxation in this posture that brings to mind the effect of a majestic crocodile enjoying a relaxed sunbath on a river bank. This practice is a useful relaxation posture for those who feel uncomfortable on their back. The shoulder and upper back as well as the lower limbs get an excellent yet non-stressful stretch that triggers off the relaxation response. If you feel that it is too stressful to keep your chin on your hands, you may place your forehead there instead. Chandra Nadi Pranayama. Sit in Vajrasana and perform Nasika mudra with your right hand. Close your right nostril with your thumb. Inhale slowly through your left nostril for a count of 4. Now exhale through the same left nostril for a count of 8. Keep your right nostril closed throughout the duration of the practice. Repeat the Chandra Nadi Pranayama for a minimum of 9 rounds at each session. Patients of anxiety, hypertension, diabetes, insomnia, and other stressful conditions can benefit by practicing this pranayama 27 times before breakfast, lunch, dinner, and before going to bed at night. Pranava Pranayama. This pranayama uses the primordial sound of the Omkara and has unlimited healing potential. It harmonizes the body, emotions, and mind and is an important part of the Rishi culture Ashtanga Yoga tradition as taught by Yoga Maharshi Dr. Swami Geetananda Giri. In this practice, emphasis is first placed on making the sounds A, U, and separately and then in combination. This is followed by the performance of the practice mentally without the audible sound. Sit in Vajrasana and place the chin mudra on your thighs. Breathe in deeply into your lower chest area. 2, 3, 4, 5, 6. Breathe out with the sound A. Breathe in 2, 3, 4, 5, 6. Breathe out. Breathe in. 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound A mentally and perform the same practice 3 times without the audible sound. Curl your fingers inward to form the Chinmaya mudra and place it on your thighs. Breathe deeply into your mid-chest region. 2, 3, 4, 5, 6. Breathe out with the sound OO. Breathe in. 2, 3, 4, 5, 6. Breathe out. Breathe in. 2, 3, 4, 5, 6. Now concentrate on the sound OO mentally and perform the same practice 3 times without the audible sound. Perform the Adi Mudra by clenching your fists with your thumb in the center and place the mudra on your thighs. Breathe deeply in your upper chest and clavicular regions. 2, 3, 4, 5, 6. Now exhale with the sound Breathe in. 2, 3, 4, 5, 6. Breathe in. 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound mentally and perform the same practice 3 times without the audible sound. To perform the 4th part of the practice that unites the 3 earlier parts, perform the Adi Mudra and then place it with the knuckles of both hands touching in front of the navel. This is known as the Brahma Mudra. Take a deep breath into the lower, mid and upper chest regions. Now let the breath out with the sounds A, U, M. Breathe in 2, 3, 4, 5, 6. Breathe in 2, 3, 4, 5, 6. Breathe out. Now concentrate on the sound and perform the same practice 3 times without the audible sound. A performance of 3 to 9 rounds of the Pranava Pranayama, when done daily, helps to relax the body, emotion and mind complex and provides complete healing through the production of healing vibrations at all levels of our existence. This is the cornerstone of yogic breath therapy and can produce health and well-being for all. When the concentrative aspect of the practice is taken to its peak, a state of meditation or pranava dhyana can ensue. Shitali Pranayama. Sit in a comfortable and straight back Vajrasana. Roll the tongue into a tube by folding up the sides of the partially protruded tongue so as to form a long narrow tube resembling the beak of a bird. Pressing the lips round the tongue further narrows the passage. This gesture is called Kakachandra Mudra or the crow's beak gesture. The tongue should protrude 1/2 to 3/4 of an inch beyond the lips. Inhale in short gulps of air along the rolled up tongue until the lungs are completely inflated. Perceive the cooling effect of the air as it passes through the tongue. Allow the breath to be stopped effortlessly. Exhale slowly through both nostrils. Then allow the breath to be held comfortably before the next inhalation. Repeat the cycle at least 9 times. Shitali Pranayama has a very good effect upon Vata and Kapha disorders. It produces a sensation of satiety that helps us reduce the tendency for overeating. Spanda Nishpanda Kriya. This practice is done from Shavasana using the yogic concept of Spanda and Nishpanda, which means the coupling of tension and relaxation. We consciously tense different parts of our body as much as possible and then relax them to the maximum in a step-by-step manner. This produces a better relaxation response than the mere attempt to relax without putting in the initial effort of tension. Lie down in a comfortable supine Shavasana with your entire body in a single straight line. After a few seconds of relaxation in this position, start to tense your entire body part by part from your toes up to the top of your head until every part of your body is as tense as possible. Hold this 100% tension state of Spanda for a few seconds. Let all the muscles of your entire body be as tense as possible. At the peak of the tension, just let go and immediately relax your entire body 100%. This is the state of Nishpanda. Enjoy this relaxed state and with conscious awareness, continue to watch your breath as it comes in and goes out of your nose. Repeat this practice again by tensing up your entire musculoskeletal system to the state of Spanda and hold it for a few seconds. When ready, let go completely and enjoy the Nishpanda state for a few minutes. To complete the practice, repeat the Spanda Nishpanda Kriya a third time. Be aware of how all your muscles relax in this practice because the relaxation is deepened when it is contrasted with tension. This practice is a boon for those suffering from psychosomatic, stress-induced and stress-aggravated disorders such as hypertension, diabetes, asthma, insomnia, peptic ulcers and bowel disorders. It is also useful for patients of musculoskeletal problems such as neck pain, back pain and arthritis. Kayak Kriya. Lie supine on the ground with your head preferably to the north, enabling your body to be in alignment with the Earth's electromagnetic field. Make sure that your head and body are in a straight line while your hands are kept relaxed by your side with the palms facing upwards. To perform the first part of this 4-part practice, adjust your feet so that they are 1.5 feet apart. Perform a few rounds of regular breathing with equal duration for the incoming and outgoing breaths. As you breathe in, turn your toes inwards at the ankle until they are touching the ground between your feet. On the outgoing breath, turn your feet out at the ankles until your little toes are touching the ground on the outside. Continue 3 to 9 rounds of slow abdominal breathing and continue this foot turning action. After 3 to 9 rounds of this practice, let go and relax for a few rounds of deep breathing. Let go of all physical tension and lie still without squirming, fidgeting, or feeling the desire to move for a few minutes. To perform the second part of the Kayak Kriya, keep your feet close to each other while your arms are relaxed at your side. Take in a slow, deep intercostal breath and roll your arms along the ground as far out as they can go. On the outgoing breath, slowly roll your arms back inwards until your palms come in touch with the outside of your thighs. Continue this movement with breathing for 3 to 9 rounds by rolling your arms outwards on the in-breath and then rolling them back to the thighs on the out-breath. Make a mental note of the fact that the arms movement is the complete opposite of the earlier leg movement. After 3 to 9 rounds of this practice, let go and relax for a few rounds of deep breathing. To perform the third part of the Kayak Kriya, while breathing deeply into your upper chest, slowly start to turn your head to the right side. As you breathe out, roll your head back to the center and continue rolling over to your left side. Resist the temptation to roll the head too quickly. Continue the slow head rolling for 3 to 9 rounds. Finally, after a particular outgoing breath, let your head relax in the mid position and totally let go of all body tension. Part 4 of the Kayak Kriya includes the combination of the first 3 parts. Start rolling your feet inwards on the abdominal inspiration. Roll out your arms on the mid-chest inspiration. And finally, roll your head to the right side with the clavicular inspiration. Release the abdominal breath and roll out the feet. Continue the expiration from the middle chest and roll your arms inwards until they touch the thighs, and while releasing the breath from the clavicular area, roll your head from the right side to the left. Perform 9 rounds of this 3-part body action in tune with the breath. Coordination between body movement and the breath cycle brings about a reunion between the body, emotions, and mind. As most disorders are psychosomatic in nature, this reunion of the body, emotion, mind complex helps the patient to recover from their troubled condition and attain to as perfect a state of health as may be possible in the given circumstances. After performing the 9 rounds of the Kayak Kriya, collapse in the Nishpanda, the deep relaxation state. Let go of all physical tension and lie still for a few minutes. Anuloma Viloma Kriya. The Anuloma Viloma Kriya is a polarity practice that helps normalize the body's inherent polarity. 2 major variations are used to produce a state of deep relaxation. Lie down in Shavasana, the corpse posture, with your head to the north in alignment with the electromagnetic currents of the planet. Perform a few rounds of deep, rhythmic Savitri pranayama. Breathe in 1, 2, 3, 4, 5, 6. Hold in 1, 2, 3. Breathe out 1, 2, 3, 4, 5, 6. Hold out 1, 2, 3. When you have a certain degree of control in the Savitri pranayama, start to feel the warm golden prana coming from above your head and going down to the feet on the incoming breath. This pranic flow is allowed to completely move beyond the feet. On the outgoing breath, feel the cool silvery apanic flow enter the feet and flow back through the body and out the top of the head. Continue this pranic apanic flow until a state of deep relaxation ensues. Enjoy the sense of complete, unconditional relaxation. Another form of polarity kriya can be done by splitting apart the 2 flows so that the apanic flow is felt to move downwards only on the left side of the body through the Ida Nadi, while the pranic flow flows up on the right side of the body through the Pingala Nadi. The Savitri pranayama is used and the kriya is done over and over again until deep and conscious relaxation is produced. Chakra meditation. This meditative sitting is best done facing north or east. The performance of a few rounds of deep and conscious breathing in Shavasana prior to this meditative sitting can serve to enhance its effect drastically. Sit in the Vajrasana or take up any sitting posture in which you are absolutely certain that the spine is yogically erect. This makes sure that the energy can move upwards in an effortless and smooth manner. Perform the Chakra Pranayama as follows. While breathing in, visualize pranic energy rising from the base of your spine up through the 6 chakras situated along the cerebrospinal axis. While you breathe out, visualize the prana coming down through the same 6 chakras. Imagine that your body is a 6-storied building and the prana is rising and descending on an elevator. A held in and held out breath can be added appropriately at the back of the brow center, the Agya Chakra, and at the base of the spine, the Mooladhara Chakra. As you come up through the chakras, starting from the base of the spine and through to beyond the top of the head, try to become aware of each of these centers. With practice and inner growth, these centers will start to become conscious centers, filling with light, sound, and color. When the breath is completely filled in and you are in the Sahasrara Chakra beyond the top of the head, hold your breath in a Prana Kumbhaka, a held in breath for a lengthy period of time. Slowly let the breath out and keep your concentration in that 1000-petaled lotus chakra. Let the breath take on any form it wishes and simply hold the idea that you are sitting in the midst of a beautiful 1000-petaled pink lotus. Hold that idea as long as you can, repeating the visualization over and over until a pleasing sensation of being suspended comes about.
Namaskar. Welcome to this series of videos where we shall take a look at various applications of yoga as a therapy. Yoga is the ancient art and science that has sprouted from the fertile soil of the Indian culture. Yoga is popular today more as a therapy. More people come to yoga to improve their physical conditions, to improve their mental conditions, to improve their emotional conditions. Yoga as a therapy is much more recent in the wonderful long history of yoga. Yoga is primarily an art and science of spiritual evolution. Yoga helps us unify all aspects of our very being. The physical body in which we live our daily life, the energy body without which we will not have the energy to do what we do, the mind body that sends the mind impulse, helping us to do the tasks with mindfulness, the higher mind, and finally the universal body. The physical, the energy, the mind, the higher mind, and finally the universal body. All of these bodies are unified by the very practice of yoga. Yoga helps bring about a union between the body, the emotions, and the mind. It can be said to be the science of right useness. using the body, using the emotions, using the mind in the right manner. One of the best definitions of yoga is that yoga is a way of life. It is not something you do for 5 minutes a day or 20 minutes a day. It is a 24-hour lifestyle. Yoga helps us to live better. Yoga helps us to think better. Yoga helps us to become better at whatever we are. The ultimate goal of yoga is spiritual evolution. Yet, in the modern world today, one of the major reasons people take up yoga is as a therapy. Illness, disease, and so many disorders are so common in this world that people want a remedy. They want relief from their suffering. According to the Bhagavad Gita, the ancient text which can be said to be the Yoga Shastra, Lord Krishna defines yoga as Dukkha Samyoga Viyogam Yoga Sangitam, meaning thereby that yoga is the disassociation from the union with pain. Pain, suffering, disease. Yoga offers a way out of all of this. One of the foremost concepts of yoga therapy is that the mind, which is called the Adi, influences the body, creating Vyadhi or disease. This is known as the Adi Vyadhi or Adija Vyadhi, where the mind brings about the production of disease in the physical body. Nowadays, this is called psychosomatic illness. Virtually every problem that we face in our health today has either its origin in psychosomatics or is worsened by the psychosomatic aspect of the disease. The mind and the body seem to be fighting each other all the time. What the mind wants, the body doesn't do. What the body wants, the mind doesn't do. This creates a dichotomy, a disharmony, a dis-ease. Yoga, unifying the mind and the body along with the emotions, helps restore the balance, restoring equilibrium. These psychosomatic disorders that are so prevalent in today's world, they can be prevented, controlled, possibly cured with the sincere application of yoga as a therapy. Psychosomatic disorders go through 4 major phases. The first is the psychic phase, where it's all the stress in the mind. There's a jitteriness, there's a tension, a sense of not being at ease. If this continues, the psychic stage becomes a psychosomatic stage. Now at this stage, the mind and the body, they are troubling each other, and the body starts to have these temporary fluctuations, such as your blood pressure goes up, or your blood sugar goes up, or your heart rate goes up. And then if this is allowed to continue, it becomes a somatic stage, where it is settling in your body, and then you are having that condition permanently. It is a condition which requires treatment and therapy. The fourth of the stages is when all of this psychic, psychosomatic and somatic conditions have now settled into the organs, creating the organic stage of the disease, which could be termed virtually the end stage of the disease. Yoga therapy works excellently at the psychic and the psychosomatic stages. Once the disease comes into the somatic stage, yoga therapy along with other therapies can definitely help improve the condition. When it comes to the organic stage, yoga therapy's role may be more of palliative, pain relief and rehabilitative nature. The major role of yoga is as a preventive therapy, preventing that which is to come. Maharishi Patanjali in the Yoga Sutras tells us, Heyam Dukkham Anagatam. Let us prevent those miseries that have yet to come. If yoga is taken up in the childhood itself, we can prevent so many conditions from occurring later on in life. This is primary prevention. Once a condition occurs, once the disease has set in, we have secondary prevention, which is more of the nature of controlling the condition to whatever extent we can. And then tertiary prevention, where once the condition has occurred, we try to prevent the complications, those complications that can affect the quality of life and even the quantity of life in our patients. I would like to conclude this introduction with a word of caution. Yoga therapy is not a magic therapy. It is not a one pill for all ills. There should be no false claims, tall claims made in this field, because yoga therapy is also a science. It has to be approached in a scientific step-by-step manner. It should be a one-on-one therapy where the therapist can modify the practices as per the individual requirements. It is not one size fits all or one therapy fits all. We need to take into consideration the age, the gender, the physical condition, as well as the condition of the disorder when we are applying yoga as a therapy. A step-by-step approach involving aspects of diet, involving aspects of our lifestyle, involving aspects of the way we think, involving yogic counseling. Well, all of these are part and parcel of yoga therapy. When such a yoga therapy is applied, I am sure that you will find tremendous changes in your life. The quality of life improves drastically, and in many cases, even the quantity of life improves. I wish you a wonderful time, a time where you can help evolve from that animal nature to the human, to the humane, and ultimately the divine nature through this wonderful art and science of yoga that now you are being introduced to as a therapy. I wish you a happy, a healthy, and a fruitful sadhana in yoga. Namaskar.